Hi, everybody. I hope you're hearing me, that there is no problem with the connection. Why artificial intelligence is critical for literature discovery. A very well welcome to all participants of our webinar. It's great to see that so many people have registered for this webinar at this year's virtual book fair. My name is Gregor Bangert. I'm working for Karger Publishers as manager for medical societies and industries. I'm speaking to you from Basel, Switzerland, right now, the headquarters of Karger Publishers. I wished we could meet in person at our stand at the book fair. That's not possible for reasons we all know. Let's hope that we can meet face to face next year. The coronavirus has not only changed our lives dramatically, it has also led to one of the biggest explosions of scientific literature ever. On January 30 of this year, 50 papers had been published on the coronavirus in 20 days, according to the journal Nature. That's shortly after the official breakout of the virus. In May 13, however, the journal Science reported that more than 23,000 papers had been published, and this number was doubling every 20 days. Scientists are drowning in COVID-19 papers. The question is, can new tools keep them afloat? And we all know that COVID-19 is only a tiny part of current medical research output. This leads us directly to the title of our webinar, Why AI is Critical for Literature Discovery. It's not a question from our point of view, it's a statement. And you will learn in the coming 55 minutes what our speakers think about the use of artificial intelligence in this field. I'm very happy to welcome two very inspiring men as speakers to our webinar. Dr. Oliver Renn, who is joining us from Zurich in Switzerland, and Dr. Jeff Saffer, who had to get up very early as he lives in Nevada, USA, near Las Vegas. Oliver Renn is working at ETH Zurich as head of chemistry, biology, and pharmacy information centers. And Dr. Jeff Saffer is the president of Quertle, a US company that has developed a discovery based on artificial intelligence for biomedical literature. Both Oliver and Jeff are no one-track specialists. They are at home both in the academic and in the corporate world. Oliver is a trained chemist. He was publishing director at Springer, now Springer Nature, and he worked in the pharma industry as head of the Global Scientific Information Center at Boehringer in Germany. At the ETH, which is the leading university on the European continent, Oliver has multiple touch points with AI-based tools as an information expert and as a lecturer working with PhD students. Jeff Saffer is a close partner of Karger Publishers. As said previously, he is president of Quertle, the company that developed Qinsight, which he will show to us in a live demo. He has been in biomedical informatics for more than 2 decades. He made his PhD at Yale University in molecular biophysics and biochemistry. After his postdoc at the National Cancer Institute, he was the head of the Molecular Biosciences Department at the Pacific Northwest National Laboratory. Jeff is supported by Andrew Friedheim, head of business development at Quertle. Welcome, Andy. We want this live webinar to be as interactive as possible and ask you to send us questions and comments, which will be answered in the last 15 minutes of our webinar. We will now send you a poll about your favorite search engine for scientific searching through the chat channel. It would be great to include the results of this poll in the ongoing webinar. This webinar will be recorded and you will receive the recording through email. Let's have a look at the agenda. We will start with chat. Intelligence discovery, be followed by a demo of Qinsight. Oliver will then tell us about his work with students at ETH in Zurich and how he tries to motivate them to use modern tools for discovery. At the end, we hope to have enough time to answer all of your questions sent by chat. Anyway, you will receive all information on our website, karger.com, and the URLs will also be sent to you via chat. Do we see the results of our... Yeah, I don't see the results of our poll. I will ask my colleague Nadine, do we have the results? She's running to me. Yeah, that's wonderful. Okay, 40% use PubMed, 90% Google, 17% Google Scholar, 13% the catalog of the university, and 1% other search engines. That's fantastic. That's not so good for our universities because they invest a lot into discoveries. I want to start this discussion by asking Jeff. Jeff, what particularly raised your interest in artificial intelligence when you were a scientist in a biomedical laboratory?
Well, there was a period of time where the technologies were changing so rapidly, and we became overwhelmed with the amount of data that we were producing in the laboratory. So to use that effectively and really understand the results of our efforts, started working on big data and artificial intelligence at that time.
What kind of AI applications are used for literature searching? Could you please give us an overview? And that would be great.
Okay, can you see the screen now?
I can see the screen, yeah.
Excellent. So talk about the options for artificial intelligence to really bolster literature discovery. To start with, though, as context, let's ask the question why AI is needed. There's tens of millions of documents that are relevant. In the biomedical field, there's more than 30 million journal articles alone. And then when you add in all the other sources, patents, clinical trial documents, and so much more, it's really a huge amount of information. And using traditional searching with this volume of information has turned out to be quite ineffective. You get overwhelming lists. There's so many irrelevant articles, you narrow it down and start throwing out critical information. Even if the information is relevant, it is very difficult to explore and understand, and there's a lack of context. Without being able to see how all the pieces fit together, really decisions are very difficult to make. This negative impact of traditional searching in the biomedical industry has been estimated to be over $100 billion per year. That's a very significant impact. So let's now talk about the options we have for using artificial intelligence to break through this problem. One that you may have heard a lot about is natural language processing, or NLP. This is a simple form of artificial intelligence, a rule-based method to extract information, such as a subject, a predicate, an object. As an example, SARS-CoV-2 causes COVID-19. So to extract these kinds of tidbits of information allows many things to happen. The NLP is great then for this basic text mining and extracting these connections. There are some serious limitations though. NLP is typically very hard to use. It requires programming as well as those ongoing costs. it's slow. Setting it up and getting the results you want can take days to weeks to get answers. And importantly, triplets like this subject, predicate, object are not the only knowledge representation in the literature. So you're then missing a great deal there. An example of natural language processing might be, say, Lingomatics I2E, just to give you an example. Knowledge graphs. These are ways to assemble relationships, often that have come from natural language processing, and this is using causal or trait relationships. The benefit here then is that you have an opportunity to discover those indirect connections. One author says A is connected to B, another author says B is connected to C, therefore you can infer that A is connected to C. This too has its limitations. It's very difficult from these network graphs to gain a global perspective. Once again, there's a lack of context. How do you know that a particular relationship is valid for what you're interested in? Does this really occur in the patients that I would be interested in? And there's often incorrect inferences. A rather contrived example, but here, bananas are yellow. Yellow is a sign of jaundice. Many knowledge graphs will make the assumption then that bananas are related to jaundice. That is not correct. So these kinds of causal relationships can't just be done blindly. Very important to keep that in mind. An example of a knowledge graph would be causally. Citation networks. This is where people are using artificial intelligence to look at the different references in the documents so that they can infer that documents that mention the same references are talking about similar concepts. Once again, this is great for finding papers, but the limitations of being difficult to navigate. Any method that is based on citations is inherently biased. You always are weighting towards older references and basing your information on that rather than new information. And of course, this is just a poor surrogate for actually understanding the author's messages. An example of a citation network would be Meta. Then there's methods like deep learning. And here you might think of IBM Watson. This is where you use all these neural networks and discover features to describe the data. And this is really good for complex relationships. However, this type of deep learning requires training sets for every single use case. And that training can take years. And then since the biomedical field is advancing during that training time, what you've trained it on is now no longer relevant and it's out of date. And most of the AI methods based on these kinds of deep learning also introduce discovery bias based on what other people have been doing. So not ideal either. In addition, the AI methods that you may have run across and maybe why you haven't been adopting them, they're still using PubMed and Google Scholar, is they're difficult to use. You can't simply write a question and get an answer. They don't disambiguate terms. Imagine in the biomedical field, a paper says bad. Does it mean something that's a negative, or does it mean the gene name bad? That's a very difficult problem. There's multiple names for everything in the literature. Bad has different names, diseases have different names, acronyms all look alike for different things. Very importantly, as we're trying to make decisions from the biomedical literature, there's no measure of believability from these methods that we've talked about. For example, what is the level of evidence that supports the conclusion? And of course, there's no predictive capabilities. So what we really want if we're going to have an AI method for the biomedical literature, we want that power of AI that's possible, of unprecedented discovery. But they have to be with methods that understand biology and medicine. And this includes the discovery of aliases, being able to disambiguate those terms. It needs to be even easier to use than PubMed or Google Scholar. support for plain English queries, and you want immediate results that are sorted by true relevance and incorporate some level of evidence. And predictive visual analytics would really help you understand these. So with all that in mind, at Quertle, we developed Qinsight, which uses biospecific artificial intelligence that we developed, coupled with these visual analytics and a way to move from search to actual discovery.
Thank you very much, Jeff, for this general overview about AI in discovery coming from an expert. And yeah, I think it's time for a live demo of Qinsight and show a bit the differences to traditional keyword searching.
Certainly. For this short demonstration about Qinsight, I'd like to actually start with PubMed, just for comparison. And since so many people said you're using PubMed and Google Scholar, let's do this. And let's pick the topic that's on everyone's mind these days. And I'm going to do a query for beta coronavirus. I don't want to focus just on SARS-CoV-2. I want the entire class of related viruses, which includes SARS and MERS, because there's very important lessons to be learned from that content as well. So let's do this search on PubMed. We get 32,000 results. That's great. We say, this is wonderful. I've got a huge amount of information. All right, well, maybe it's not so great. How do I actually understand this? I cannot get my arms around this entire set of 32,000 documents without reading them. That's not very effective. So this is one of the reasons why AI is important. And as you'll see in just a moment, even the issue about this overwhelming number of results is a problem. Let's now go to Qinsight, Quertle's version of AI for literature discovery. I will do the same query. And the first thing I want to point out to you is that Qinsight, using its artificial intelligence, was able to find 105,000, almost 106,000 results. So more than 3 times the number of documents that are found in PubMed. Now, in Qinsight, we cover not only all the journal articles, but clinical trials, patents, treatment guidelines, NIH grants, and much more. So maybe just to be fair to PubMed, let me limit this to just journal articles. Even so, with journal articles, which are the core of PubMed, there are more than 95,000 results. So still, with PubMed, only 1/3 of the available information is being presented to you. And there's just no way we should be making our biomedical decisions without all of the available information at hand. And then with this information, we might want to explore this in interesting ways. One of the aspects of the Qinsight AI is the automatic discovery of concepts that are related. Here you can see all of the different concepts related to beta coronaviruses, including the viruses themselves and diseases like COVID-19 that are specifically from those viruses. And then we have general concepts. And here, for example, even if you don't know anything about the biology of SARS-CoV-2, you can see that the ACE2 protein from human is important, the S protein from the virus is important, and it allows you to begin to explore this in a very meaningful way. Maybe we want to limit the results to just clinical information. Rather than relying on publication type, very ineffective, we'll let the AI use a concept-based query. And here it's looking now through all these papers, finding those articles, once again, just the journal articles now that are focused on clinical. And you can see we're finding things like patients. So again, it's not just keyword searching. The AI is much smarter than that. So it gives us a way to really explore this, and we might want to look at particular patient populations like the elderly and so on. Very easy to explore and really begin to understand what this huge amount of information is all about. So just to follow a logical flow here, maybe we're now interested in trying to understand drug repurposing for coronaviruses. So I'm just going to ask now a plain English question. What compounds have been used for beta coronavirus? Here you can see the artificial intelligence has been smart enough not to search for the word compounds and so on, but rather is understanding I'm trying to answer the question. So it is showing me results where there's a meaningful connection between some compounds and a beta coronavirus or a disease associated with the beta coronavirus. So highly relevant results. And once again, we can see that in the key concepts, we actually have an answer to the question, what are the compounds? It's a huge, long list. So how do we really get a handle on this? We can start looking at these one at a time. We can click. For example, I'll click on ribavirin, and I can see what's going on there. Let me just go back here and remove this filter. And what I would like to do is show you an example of a visualization, one of the predictive visual analytics, in this case, the connections visualization, because I want to look for all of the possible connections among these different compounds or treatments. That takes the AI a minute or so to build that and actually learn on the fly from the information that's available. So I did this just before we started. Let me change this just a little bit here. In this map, we have all of those different compounds, and the color orange you see off the diagonal is now a measure of the overall probability that that pair of treatments is likely to be important for the use of treating beta coronaviruses. So, for example, here for favipiravir, let's look at, say, something like this square I'm hovering over, favipiravir and arbidol. It says that the authors have either explicitly stated something or the AI looking across the entire set of papers is able to predict that this combination may be useful. All of the visualizations in Qinsight are fully interactive. I will click on this. Now we can see exactly why this is important. And in this case, you can see, for example, that arbidol, also known as umifenavir, you don't have to worry about knowing all those names. The AI takes care of that automatically for you. But here is a way then we can hone in and see exactly what's being said about these two compounds and their connection and make a decision, is this a combination therapy that we ought to pay attention to? And now suppose that we look at this and say, all right, this is great. I'm gonna maybe focus in on favipiravir. We might ask a simple question now about what biological processes have been connected to favipiravir. And once again, we're gonna get an answer to that question, and we can see there's many things. One thing that jumps out right away is this QT interval. And if you look at these results, for example here, you can see that there is an effect of favipiravir on the QT interval, at least in some populations. And this suggests, well, it may be effective treatment for coronavirus. It's not something you want to give someone who already has a problem with the QT syndrome. So a very logical kind of question that you would want to do before you invest a lot of time on the actual investigation of the drug. Now, as a final example, and just to show the versatility of this application, I want to choose a genetic example. And here I'm going to ask a question about what genetic factors are associated with gliomas. It's very important that whatever application you're using today is genetics aware. With personalized or precision medicine being so important, we need to be able to understand what the concept of genes and genetic factors are. Once again, the AI has identified highly relevant documents right away that tie some genetic factors to a form of glioma, including glioblastoma. let's look here at the genetic factors. It's not just genes and proteins that we normally think about, but it's like microRNAs and others. We're also reminded by the AI that there's many different types of gliomas, and we could easily hone in on any one of these that we might be interested in. Here, the question is, well, how does this change over time? This is a summary of the genetic factors, again, a long list over all time that this has been studied. Say, let's change this to just the last year. Now we can see that this list has changed. Isocitrate dehydrogenase has now moved way up on this list. It says it's a more recent interest in this particular field. Well, this changing landscape led us to think, well, since we're using artificial intelligence, shouldn't we be able to train it to be able to predict trends? And in fact, the answer is yes. So we can use this trends visualization. Once again, it takes about 30 seconds to build, and to save time, I did this in advance. Another interactive visualization, in this case, all of these blue bubbles that you see are genetic factors involved in the in some form of gliomas. And if we're investigating all these, it's our human nature to start with the biggest ones, oncogenes as a class, microRNAs, AKT, et cetera, EGFR, very important for gliomas, and work our way through here. We'll get tired after a while and probably ignore many of these down at the bottom, or the smaller bubbles. But as you can see, there are a number of these that we see here where there is a red border around it. And this is an indication from the artificial intelligence that there is a reason to believe, from what the authors are actually saying in those papers, that there's a more likelihood that that will be important to our understanding of gliomas. And just as an example, let me click on CXCL8, also known as IL8. So this is a prediction from the AI that says, once again, that from the information available in the literature, there is a reason to believe that that's going to be more important and would be a useful line of investigation that we might have overlooked otherwise from that long list. So this has really just been a short glimpse into what AI can do, but I hope you have seen how powerful yet easy to use the right kind of AI can actually be. Thank you.
Okay, I want to thank Jeff very much. Yeah, it's early in the morning in Nevada. Yeah, you did a great job. Yeah, and I think the take-home message for me was that Qinsight is looking for meaningful connections and creating relevant concepts for the search terms on the fly. And it can even give you information on topics that will become more important or less important. And it's not only searching through scientific articles, but many more documents like patents, grants, and even use in the health industry. Now it's time to turn to Oliver Renn. I would like to ask you, how open are young researchers for AI-driven tools like Qinsight? Could you tell us more about the courses you teach at the ETH Zurich? We cannot hear you.
Now sorry? You can hear me also.
Yeah,
right?
Now we can hear you.
Okay.
Yeah.
Okay, now you have seen a tool that is capable of doing really very sophisticated information discovery. And the question is, will it get used once it's made available? And polls like the one you saw before, but also other polls show that most users are using Google or Google Scholar, and there's only a small group of researchers that actually use sophisticated tools. And the quote on the left, it's an advice from a supervisor to PhD students. This is a quote which I have heard not only once. And you think that should be easy to get researchers into using sophisticated tools because there's an overall interest in AI. On the left, you can see the increasing number of publications on AI worldwide, and below on ETH Zurich. And just today, ETH Zurich announced that they will open an ETH Zurich AI Research Center on October 20. But unfortunately, the effort that is needed to implement a new tool among researchers and students is pretty high. So how to do it? This is our recipe. You have to do a lot of outreach, and we have developed over the past years 5 formats that help us to increase awareness and utilize education and training for many tools at ETH Zurich. So these are the 5 formats. First, the coffee lecture, the research group, menu cards, the courses, especially the course Scientific Information Retrieval and Management in Life Sciences and Chemistry, which is tailored for PhD students. And so these 3 are all face-to-face, and we have 2 other formats for those who prefer reading on their own. We have a personalized newsletter that updates you on new information. If there's a match of your interest, like a dating platform, then you get an email if it's of interest to you, and a newsletter for the community, for users of scientific information, which we call InfoScene. So let's start with the coffee lectures. Coffee lectures, a format I have developed years ago, and it's now very popular among university libraries, particularly in Switzerland and Germany. And the core idea of the coffee lecture is that you limit the event to just 10 minutes or 15 minutes at noontime, where everyone needs a coffee, and you provide a free coffee and some entertaining education. And 10 minutes are usually enough time to raise awareness and showcase the value of a tool. And if it's not really interesting, there are usually no bad feelings because you provided a free coffee, which you would anyway have during noontime. And we usually do a 3-week series of 9 different lectures. And at our coffee lectures, we provide at the end also a coffee lecture collector card, where the basic information and the basic value of the tool is summarized. And you can see here the example for the coffee lecture card for Qinsight. And we have also developed a coffee lecture collector's card album, where you can tick which coffee lectures you already attended, which coffee lecture cards you have. And we have meanwhile a series of 69 different coffee lectures, which are covering all fields of interest at ETH Zurich, particularly in the fields of chemistry and life sciences. And now you are probably curious how we do such a coffee lecture. So I give you an example how we do it. I'm not giving you a coffee lecture, just showing you how we do it. As said, we provide free coffee and show that it's hand filtered by us. And then we usually take here's the problem and this is the solution approach, or we start with something unexpected, like showing this visual and asking what this could mean. And of course, these are tired students. You can see this also at ETH, but nobody has really the answer that this is a relatively new mesh term, a mesh term that was introduced 2019 because PubMed decided that this is going to be important in literature. And most of the people in the audience have no idea what a mesh term is, but they rely on the mesh term if they are using PubMed. Then I show a PubMed search, and I use usually an example which is not too specific, quite funny, like this syndrome, which is called Alice in Wonderland syndrome. And you can see there are 52 papers that deal with the Alice in Wonderland syndrome. And you get these papers because either Alice in Wonderland syndrome is in the title or in the abstract, but you see also papers that have nothing like this in the title nor the abstract, but it's found because it has been indexed with the mesh term Alice in Wonderland. So you really rely on the indexers, and they decide what you retrieve. If they think this is really important and this is covering in detail this issue, they will index it. So you depend on them. So this is another example of a search in PubMed, a search for a protein, and you get only 4 results in PubMed. You might think, well, this is an uninteresting protein. If you're interested if there's anything done in cancer, you get 0 results. You might think, well, this is somehow freedom to operate because no one is working on this field. However, if you redo the search in Qinsight, you get 180 results, close to 200, including the broader results, and they are all meaningful, as you can see immediately from the relevant statements. And if you limit this to cancer, you still have 33 papers, and obviously from the relevant statements, they all really deal with cancer. So this is information you would really have missed if you would have relied on PubMed only. To show the beauty of being able to search in natural language, I also like to use examples which are not really very scientific. So like this example, what makes women attractive for men? And if you do that search in PubMed, you get a few results and they are not really meaningful. They have nothing to do, as you can judge immediately from the title, with your question. But if you do the same search in Qinsight, you get meaningful hits, papers like the first one, which is obviously related to your query. And this paper is actually, of course, included in PubMed because this is a journal that is covered by PubMed. And if you look at the paper in PubMed, you can see which mesh terms the indexes used, and there are quite a lot, but of course there are no mesh terms that could relate to your query. So this would be a query that couldn't be answered by PubMed, but by Qinsight. Then I always like to show the power terms, which I really like. And there's a growing list of power terms. Meanwhile, I think you have to build an application that helps them to search because there are so many. And I like the action terms a lot because usually you can search for a noun, but not for verbs and subsequently not for action. So with that power term action or interaction or positive action or negative action, you can actually search for a certain relationship, as Jeff pointed out. So if you search for papers that contain a certain gene that has a negative impact on tamoxifen, a cancer drug, you get 200 meaningful results, and you could drill down even further by adding metabolism, and then you get 56 papers, and you immediately see from the relevant statement what it is, and this is a number you can use. Comparing and contrasting this to PubMed, translate this query into this one, you get, of course, more papers because the query is very unspecific. If you look in the advanced search how PubMed translated your query to get these almost 500 results, you can see that it's a very, very broad query, including lots of very generic words, and that's the reason why you get so much papers, and you're probably not willed to go through 500 papers. So this is a basic concept of the coffee lecture, entertaining examples, short but showing the value of a tool. If you want to know more about the coffee lectures, there's meanwhile a page for coffee user group, both in English and German, where you can find publication on coffee lectures, libraries that have coffee lectures, and next year there will be another user group meeting. So next is our research group seminar menu card. For research group, we developed another format for education and training. And if you would have a course catalog for all tools, it would probably look not very appealing. So we decided to have it in a style of a menu card in a restaurant where you can select from starters, you can select the main course, desserts, and we have also special. And one of the specials is Qinsight Next Generation Biomedical Literature Searching. So this is a seminar which is tailored exactly to the needs of a research group and takes more time than a coffee lecture. And usually we discuss the research questions before. And third, as I mentioned, we are teaching also a lot, and particularly interesting is the course Scientific Information Retrieval and Management in Life Sciences and Chemistry, which we teach every fall semester. where students learn about everything that has to do with scientific information, what they need when doing a PhD. So this includes also text mining, but it includes also searching with databases, particularly for life sciences or in the biomedical field. And from this graph, you can see that we started the course in 2014 with 15 students, and meanwhile we have over 120. So this is something that takes time. Even if it's a good service, if it's a good product, it takes time. And also, if you have, for example, Qinsight within your institution, the library or information center has to make sure that it's getting used, and it will take time. It won't go from 0 to 100 in nothing. It takes time, and you have to do all this kind of outreach like we do with the magazine InfoScene I mentioned. This is also something where we frequently cover Qinsight. So for the first time it was 5 years ago when it was called Quertle, and then a new PubMed arrived last year, and we also mentioned Qinsight. So you frequently cover information on what's possible. So finishing up, I have now different roles at ETH Zurich, but if you are interested to learn more about what we do, go to the website of the Information Center at infocentrum.ethz.ch and you'll find more information. Thanks.
Yeah, thank you very much, Oliver. This was really very interesting and also entertaining. Yeah, I didn't know that we can answer the very important questions of our lives, like attractiveness among sexes, yeah, with Qinsight, yeah. This is really great, yeah. And also the indexes, yeah, that was not, it's really interesting. Thank you very much. Just let me see. Yeah, now it's time for you, the audience, and it's still, we received some questions, so thank you very much. And well, if you let me play the teacher, yeah, there are no silly questions, so you can still answer questions and take the opportunity to meet Oliver and Jeff. And I want to take one question, which is, I think, very interesting. It goes out to Jeff. Jeff, is Qinsight performing full text searches? We don't hear you.
Great question. Yes, Qinsight covers what we call the informative text of documents, the title, abstract, the body of the document, figure legends, tables, table legends, and not that every single document we have in the application is full text, but of the ones that we do have that are full text, which is more than 18 million full text documents, then we are searching that meaningful information in those documents.
Okay, wonderful. And one attendee is asking, Jeff, do you have a source for the $100 billion figure you mentioned in your presentation?
Yes, it comes from a variety of sources. For example, the European Patent Office said that 30% of R&D is wasted rediscovering published information, and based on the research investment in pharma companies, you get a number like 100 billion. We also know from our conversations with individual pharma companies that there probably isn't any major pharma that hasn't wasted $1 billion or more on more than one project every year because they missed information. So it sort of all dovetails together.
Okay. There's also one question for Oliver, a very empathic, I would say, attendee. He is asking, how's the ETH coping with the pandemic? And will you adapt your courses to an e-learning environment in the future?
So actually, we already did. So the last series of coffee lectures we did via Zoom, as usually every university is using now Zoom. So this went very well, and it had the advantage that also people outside of ETH Zurich could attend the coffee lecture. The backside was that we couldn't provide any coffee, but we invited everyone to have a coffee. For the course which we are currently teaching, at ETH, we try to have it as normal as possible. So we have, again, courses taught in the lecture halls, but we don't know how long it's possible. So every course is also live streamed, so people can decide to stay at home and watch the live stream. And even those who cannot watch the live stream can later on look at the recording. So we have 3 options to get the course. And of course, it's much nicer to teach in a lecture hall where you can see the faces, even with masks, if people are getting excited or not. So if you teach and you can't see anyone, you have no idea how many are listening and if they're really listening. So that's personally a disadvantage of this system. But in general, you can increase the outreach if you do it as an e-learning.
Okay, thank you very much, Oliver. There's also another question, more from a library point of view, technical. How does the AI actually work compared to traditional taxonomies like MeSH or M-Tree? Jeff, do you want to answer this question?
Happy to. First of all, the traditional taxonomies really have been developed for classifying documents. They are not really effective for supporting search and discovery. It takes time for new concepts to be added to those taxonomies, and as Oliver mentioned, with sleepiness as an example, only recently added. So the concepts aren't found when you're relying on taxonomies. And just because 2 concepts in the taxonomy are tagged, it doesn't mean the author has tied those concepts together in a meaningful way. The artificial intelligence, while it can be informed by a taxonomy, is able to discover information it needs in a much broader context. It is not limited to known concepts. If something brand new occurs, the AI is able to find that even though it was never in any taxonomy. So the right kind of artificial intelligence approach really can make a huge difference and not be reliant on indexing, which oftentimes is either manually done and ineffective or automated and imperfect.
Wow, thank you. Yeah, it's very interesting that at the moment a lot of questions are coming in. Yeah, so it's I think that people had needed some time to digest all the information you gave them, and I'll just take out the questions I see here, and one question is about the training of Qinsight. How is it trained, yeah, compared to Watson, or how do you do it, yeah, that the artificial intelligence improves gradually?
So two points for that question. One is that, as I mentioned, the deep learning model like IBM Watson uses fails because you have to continually retrain and the information landscape is constantly evolving. What we did for Qinsight was to train the artificial intelligence with a training application we had that was used around the world, 193 countries, which sort of indicated to us the hunger everywhere for new approaches. But the training that we did was on fundamental aspects. How do authors write papers and get their points across? What are the structures that represent the actual information beyond just natural language processing triplets? How do people ask questions of that literature, and how do they explore? So our AI learned those very fundamental aspects, which don't change over time, even though the information underneath does, and that keeps the Qinsight AI robust. As part of that, yes, there is ongoing training, but we are very cautious to make sure that there is not an introduction of bias. If you look at something like Google, all the Google capabilities, if 10 people click on one particular result, that becomes ranked higher. So you're more likely to see that, even though it may not have been what you were looking for. And that introduces the availability cascade bias, and that's definitely something we don't want to do. So all of the training we do with Qinsight is done externally to keep the AI evolving, but it is not biased by what the users are doing. And that also protects our users' intellectual property. So if they're looking for, say, some particular drug or biological system, that doesn't sort of get exposed through the AI to other people and puts it in their face as well.
Okay, wonderful. And this relates to a question we just received. Yeah, it's very interesting. I got the question, will Qinsight replace PubMed one day?
Well, it should. I mean, really, you know, it typically, and there are publications that show these numbers. You know, a typical search on PubMed will find somewhere between 10 and 50% of the available information. Google Scholar sometimes is also equally bad. Google Scholar has the other problem, though, that is so much information that it provides, and it doesn't do it very with great relevance. So you get overwhelmed and you start narrowing things down and end up still only looking at a very small fraction of the available information to make your decisions. So even though those two sources, Google Scholar and PubMed, were #1 on #2 on the poll earlier, it is clear that we're doing ourselves a disservice utilizing those kinds of approaches that are not getting what needs to be done. So okay. I am confident that Qinsight and other AI methods, particularly those that will advance, for example, without the kind of training that IBM Watson does, or not just being reliant on natural language processing, will in fact become much more common in the future.
Okay, thank you very much, Jeff. Yeah, and there's another question, I think also coming from a librarian. Maybe Andrew, you could help us. Do you think an academic institution can take use of Qinsight, or do you see it more as a tool for farmer research?
No, we have a number of academic universities around the world actually currently using Qinsight. And last year I gave a talk on using systematic reviews with Qinsight, and just the ability to explore much more than is currently available to systems like PubMed and Google Scholar. So absolutely, it's in use today. As Dr. Renn explained, his university using it, and there are many examples that are existing.
Okay, thank you very much. I look on my timer, yeah, so I will just have a look at the questions if a new question has come in. So, okay. Yeah. I think there are no new questions. There's always a possibility to contact people afterwards. That's no problem. And just a second. And yeah, our live webinar is ending soon. I want to give a very big thank you to our speakers, Oliver Renn and Jeff Saffer, for taking their time, getting up early in the morning, like Jeff, and giving us an outlook on the use of artificial intelligence in discovery and how to teach it to students. I say thank you to the attendees who joined our meeting and to those who sent questions and comments. You will find all information on today's webinar on karger.com. We already sent the respective URLs through the chat channel. If you are interested to let Karger publishers know how you liked this webinar, and tell us a bit more about your needs in research and publishing, please fill out the survey, which you will see when you leave the webinar. Last but not least, I want to invite you to our next event, which will be tomorrow, Friday at 3:30 European time, and it will be the Vesalius Innovation Award. You can see 5 startups which are pitching for this award, and yeah, could be very interesting to see what are the companies of the future. Yeah, it's time for me to say goodbye. It was great to reach out to more than 100 attendees from all over the world. So there's always something good and bad, as someone would say. And here you see a picture of our stand in Frankfurt. I hope that one day we will meet there, and hopefully with the power of and creativity of science and with some social discipline. And if it's not next year, then I hope it will be 22. And I wish you all a wonderful and successful virtual Frankfurt Book Fair. And best wishes from Karger Publishers, Basel, Switzerland. Have a great day. Goodbye.